Hello, everyone. Welcome to Dean's Chat, where we discuss all things pediatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Pediatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Johanna Richey. Hi, Jo. How are you doing?
Hi, Jeff. I'm doing well. How are you?
I'm doing great. You're holding down the fort in the studio today.
Always great to be in the studio.
Oh, that's great. Well, we have a fabulous guest today on our podcast, Dr. Martha Kenney. Dr. Kenney has lots of various expertises that are pertinent to pediatric medicine. And Jo, if you wouldn't mind giving her a formal introduction.
Yeah, absolutely. Thank you so much, Dr. Kennedy, for coming onto our program today. I know a lot of the things that you and I have had chances to connect with will resonate well with our audience. But first, I just want to do a formal introduction, but we are informal here on Dean's Chat. So if it's okay with you, we'll go by first names. So we go by Jeff,
absolutely.
Joe, and Martha. All right, fantastic.
Yeah.
So Dr. Martha Kenney is a board-certified pediatrician as well as a pediatric anesthesiologist. She completed her undergraduate degree at Brown University and went on to medical school, residency, and fellowship training at Johns Hopkins University. She's currently an assistant professor at Duke University, where she leads the Pain Equity and Disparities Lab. Her research is primarily focused on patients living with sickle cell disease in marginalized communities, and she is supported by a 5-year K Award from the National Institutes of Health. Thank you so much, Dr. Kenney, for coming onto our program today. I met you at a workshop, actually, on work-life alignment, and I know we'll shift into some of that, but I would love to get kind of your take on your career and kind of what got you interested in medicine and how you've come into all of the different facets of your life.
Well, thank you, Joe. I think my career has taken a lot of unexpected turns. And when I was turning in the direction that I didn't expect, it felt very painful. But now I'm in a place where I'm like, oh, thank God that happened. But I went into medicine because of personal experiences that I had. I'm actually originally from Ghana in West Africa. I was born there. And my first exposure to disease and the concept of medicine was from a childhood friend who lived with sickle cell disease. And what strikes me from my early childhood experiences is that he would have these recurrent episodes of excruciating pain. And I remember just feeling extremely powerless watching these episodes. And I think even as a kid, when you're a kid, you look up to adults to fix everything. And what I remember is that adults couldn't do anything. There was nothing they could do. So the adults that I looked up to were helpless, and I felt helpless myself. So even that early age, even though I had no one who was a physician in my family, had no exposure to medicine, I knew that I wanted to become a doctor because I wanted to help people like my friend. And so I went down, the path into medicine thinking I was going to become a hematologist. And I even spent extra year of research doing heme research at the NIH during medical school. And actually that year was wonderful because it convinced me that I did not want to go into the hem-onc route. And I was blessed to have wonderful mentors who were more invested in my career than trying to say that I need to walk a certain path. And so when I told one of my research mentors, who was a hematologist, that I wanted to go into anesthesia, he said, "That's great. That's going to be a great opportunity for you to occupy a niche that is very unoccupied right now." And that niche is within sickle cell pain. There's probably no anesthesiologist that's studying sickle cell pain, even to this day. Fast forward over a decade later, there are very few. I probably know less than 5 anesthesiologists that study sickle cell pain. He's like, you're going to be able to actually bring in expertise that is needed and really make a huge difference. And so that's how I ended up in anesthesia and still doing sickle cell pain research. But I think, the journey as I went through, it had a lot of twists and turns even outside of that, because right after fellowship, I did not end up with a research position. I ended up with a very clinical, 100% clinical position. And I felt really frustrated and felt like I was in a situation where I knew where I wanted my career to go, but I didn't know how to take the steps. And so that's how I got into coaching, or was introduced to coaching during that time.
Thank you so much. And what a beautiful story too, in terms of how there are little things that will spark interest and then starts you down a path. And then intrinsically you find things that motivate you in this. And then sometimes you get far enough in and it's like, this wasn't actually exactly what I was thinking or the way that I want it to go. And so I love that you can bring in insights of being flexible, and it's okay to have something in your mind as like, this is what I want to do and how I want to do it. And it works great and it supports you in that endeavor. And it's okay if it changes over time. And you're
I mean,
also,
yeah.
go ahead.
Oh, sorry to
Yeah.
interrupt, Joe. No, I was just going to add, because as you were saying it, one of the biggest things I've learned is to not focus so much on your destination and outcome when it comes to your career. Because if you're so fixated on this is the place I'm supposed to get to, and this is the place I'm trying to get to, you're going to miss out on what where the journey is leading you. And sometimes the journey is leading you away from that destination you thought that you were supposed to get to. And because you're growing as a person, we go through different seasons. We find out that there are certain things that we like, that we don't like. And so I just say, embrace the journey, enjoy the process, and be more invested in the process and less so in the outcome, because the process itself will lead you to exactly where you need to be.
Well, that's so true. Martha, I wrote down a note. You said, thank God that happened. I think we've all had those moments in our
That's
careers when we look back and think at the time it didn't seem so great, but down the road you look back and say, oh, thank God that happened. And really, that's kind of what I was hoping that this discussion would turn into, because all of your specialty areas right now, when it comes to coaching, and I also noted a behavioral design consultant, all of that is so pertinent to the physician of today, who's pulled
mhm.
in so many directions. And oftentimes, and Joe and I talk about this a lot, you want to do research, you want to teach, you want to do service to not only your college, but service to your profession. And there's only so many hours in a day.
No, I mean, absolutely. I think Joe has heard me say my mantra that I say over and over again, which is I can do anything, but not everything, which is the reality, especially if you're in the academic setting. Being in an academic setting, you have like 2.5 jobs, right? And then that's just your professional job. What about your work at home that you also have to do as well? And so I think that you do have to spend some time really thinking about what truly matters to you. Where do you find joy? In what moments do you feel like you're contributing and you're in a way that's impactful because of the skills that you have, because of the talents that you have? What moments have you had that really have just kind of sparked joy in you? And you're like, I really, really wish I could repeat today. And because as you think about those moments, I think that that will really help you to understand what really matters and what really sparks joy in you professionally. And that's what you should pursue. And it's not going to be everything. One of my mentors likes to say that, I do what I love. And then sometimes I do what I don't like because it's a gateway to what I love. I think that that's absolutely true. But you first have to know what you love.
And I think that's a really nice segue into kind of this idea. And we have touched on this a few times in the podcast with various guests, this work-life alignment. And I love that you use the word alignment. I've always struggled with the word balance. We have a colleague that uses work-life harmony, and I loved that one. I'm like, okay, I can see like that one I can get behind. But can you talk a little bit about your framework for how you kind of look at these how do you find alignment in the work that you do?
No, thank you for asking that question. Have not been a fan of the term work-life balance, right? And the reason being that I don't believe that I myself or anybody, we live in compartments. You are who you are at work and you are who you are at home. The values that you have and the values that are important to you, they're expressed at work and also at home. And if there's misalignment between what truly matters to you in terms of your values at home or at work, you're going to feel it. You're going to feel that tension. You're going to feel that inner turmoil. And so work and this is life, it just didn't make sense. And then also, can you truly achieve it at any single point? You're not really balanced, right? I like often to use the illustration, the fact that when we're in academia, you're often like doing a juggling act. This hand has work, maybe promotion and all the other aspects of, of work in your professional life. And the other hand may have some of the stuff related to your personal life, your spouse, your kids. At any point, if you're juggling 4 balls, you can only do 2 in your hand at one time. So how can you possibly be balanced in that situation? And so I, love the term work-life alignment because the framework that I use for coaching is a value. And there's a lot of evidence within the behavior science world that when people are aligned with their values, it increases their intrinsic motivation. It influences their behavior, and you actually see better and like reduced burnout, better engagement from a work perspective, and overall just better job satisfaction. And so you can have values alignment and be working 60 hours a week. You can have values alignment and be working 20 hours a week, because everyone's values is different. The common illustration I like to use is that I think all three of us, if I had to take a guess, we would say that family is something that is really important to us. We really value family. That's one of our core values. I think it's rare to come across somebody who doesn't list that as a core value. But how we express be different. For one person, it may be that providing for my family and having financial security to know that my family has everything that it needs is extremely important to me. So therefore, I might pick up extra shifts at work. I might, do some extra things, go above and beyond in terms of bringing in more money and more income so I can provide for my family in a way that satisfies me. For another person, it could be that, well, I spending quality time with my family is what's important. So family is not really about providing or financial security, but it's more about being present, physically present. And so I need to cut back on my hours and work 30 hours a week. So I have that flexibility to be present for all of the activities my kids have, et cetera. Neither individual is wrong, but both individuals will have better sense of alignment and job satisfaction, better engagement in their work if they're able to actually create their professional life to reflect those two values. Otherwise, if you put the person who wants to be physically present and spend more time with their family, and you're telling them work 50 hours a week, that's going to be challenging for that person, and they are going to burn out, and ultimately are going to leave the position that they're in.
I like that you kind of commented on the expression of values, because I think sometimes where people might get stuck is you either go through formal experience of trying to figure out what your core values are. And if anyone has not done this, it's a really useful exercise. And there's lots of resources online. And we'll get to that at the end of the show as well. But sometimes what can be hard is maybe you're kind of juggling between two different value like statements, like, oh, well, I really like to make things really fun, but I also really like adventure. And so the idea of expressing those values can be different. How do you help someone kind of work through if they're kind of stuck on, I don't know how to narrow, I've got my top 10 values, for example. How do you help them identify what questions to ask themselves, or what does that look like?
No, that's a great question. And I actually try not to start from the abstract, because oftentimes when people are talking about core values, you're handed a sheet of paper with a lot of, terms on it, and you're asked to circle which values resonate with you. And I think that then people circle the values that sound pretty good to them, but then they get stuck. What does that mean? What does that look and what does that feel like in my life? And so for me, that's the last step when I'm working with a coaching client. What I will do is actually take a step back and let's think about the moments, reflect on the moments where you felt the most joy. The moments where you felt great peace professionally in the workplace. What were you doing during those moments? Who were you with? What happened during those moments? Another question I love to ask is that what contribution have you made in the workplace by just being who you are? What contribution have you made that was really easy for you to make because you were just naturally being you? And so those are some of the questions that I like to use to probe, because once you start getting into the scenarios and they are able to reflect on, oh, you know what? I mean, I'll use myself as an example. I am someone that I really love to develop other people, especially like people. I'm early career, about to head into mid-career almost. I'm trying to, when we say mid-career, almost feels like, okay, I'm really age-wise, I'm also going towards mid-career, but I'm about to head into mid-career. So I love working with students. I love working with people who just came out of fellowship and training, and I love to develop people because I'm invested in the success of other individuals. And so for me, if I get the opportunity to help to develop someone, that is something that I find great joy in. And so that what can we name that exact value? I mean, I'll call it development. It might not show up on the sheet, but that this is something that I'm really, like, brings me great joy, whether it's through mentorship, whether it's through coaching, et cetera. And so I think really reflecting more on the moments and really thinking about the contributions that you have made, just that were effortless almost to you because you were just being yourself in those moments, is a helpful place to start. And then once you kind of have done that, then you can look at the value sheet, and then you can start putting an actual name to those moments and those actions that your memory brought up.
I love that.
Well,
What are your thoughts,
I'd
Jeff?
love to jump in. I'd just love to jump in because, Martha, when we're in an academic environment, and you're probably in the same boat, right? We all have evaluations, and we're assessed on our ability to teach and our
Hmm.
scholarly work and our service, et cetera, right? From a growth standpoint, is it better to work on our strengths and make them stronger because they're easy, it's who we are? Or is it better to work to become well-rounded and try to bump your weaknesses up? I have a thought about it, but I'm interested in yours.
No, that's a great question. Oftentimes your values may usually align with your strengths. But as within academia, obviously we have to be well-rounded. So I think it is important to identify gaps of weaknesses in areas where you do have to provide service and think about how you can actually strengthen in those areas. And sometimes it's not so much, like, for instance, most of us are in academia because we love to teach, but there's different ways that we like to teach. There are
Right.
different settings that we may love to
Right.
teach. And so sometimes it's not the weakness, it's not teaching, but perhaps the environment or the context in which the person is being asked to taught. For instance, I know people who are awesome at giving lectures. And so they are great. They're the people that you need to go to for the webinars and to give the Zoom lectures, et cetera. And there are people who will be terrible at it because that's just does not bring out their strengths of their personality, but they're awesome at practical teaching. They're awesome at simulation. They're awesome, in the old operating room setting, really teaching students and trainees how to do things. And so I think it's really understanding, like, even with a weakness, in which context does that weakness come up? In which environment does that weakness come up? And is the problem the actual skill or the way that you're being asked to express the skill?
That's interesting because I keep thinking about the intrinsic alignment and intrinsic motivations. And
Hmm.
so often those are in direct correlation with people's strengths, right? And their core values, of course. But
Hmm.
everybody has different gifts. And I've often thought that the best way to make the most out of a career is to enhance your strengths, the things that come easy to you become because that faculty member may become a superstar. Whereas you can take some faculty members and if you give them administrative duties and they don't like that at all, they're never going to be a star, no matter how
No,
hard.
yeah, absolutely.
So I find those intrinsic behaviors or thoughts or alignments and motivations to be so correlated with talent. And I realize talent is kind of over time developed too, but I don't know. I just think it's just such a complicated issue, right?
No, no. I mean, you're absolutely right. It definitely does correlate. Your strength does correlate with your values. And really drawing on those things and enhancing it does bring better alignment. I completely agree. I mean, I have great awareness about the areas where I'm not strong in. And so no, I will not, I'm not going to be the first person to volunteer in those areas.
Right.
So I have a question
Absolutely.
on that. So what about the idea that for every weakness, there's like a counter strength to that weakness? Like, say someone's not good at public speaking, they're not good at that. Um, they're more of an introvert than an extrovert. They're
Hmm.
not the one that walks and like controls a room. But the flip side to that is maybe they're really good one-on-one, where the person that walks in is charismatic and controls the room. They're more preoccupied with the not the show of it all, but like that's what they're feeding off of, and the one-on-one maybe isn't as good. What are your thoughts on? There's a term for it, but I don't remember what it is.
No, I don't understand what you're getting at. I'm smiling because you kind of described me. But I mean, I'm a public speaker, and so I've gotten good reviews. So I actually I really, really love public speaking. I enjoy it. But the funny thing is that as much as I enjoy public speaking, I hate being in crowds and actually being like, I can't run a room. Like if you take me off the stage, it's really hard for me to be in crowds and like interact with multiple people. I prefer one-on-one, et cetera. But anyways, just to answer your question, I think it kind of, it gets back to the issue. Oftentimes if someone is not strong in public speaking, it's not necessarily the public speaking itself. There's usually something else that's behind it that's holding them back, right? For instance, for me, I used to actually really dislike public speaking as an introverted person. But one of the things that was really beneficial to me from a coaching perspective, where I worked with a coach on my public speaking skills and getting more comfortable, it wasn't so much the skills, it's getting on stage would get me very anxious and get me very upset. And it drained so much energy from me. But by focusing on my introverted skills, introverts are naturally very observant, very curious. And I've, reframed when I stand on stage as really just sharing my observations about the world and really sharing my curiosity about the world. And so that reframing really changed my view of what public speaking is. When I get on stage, I'm really just sharing observations. Like right now, I'm really just kind of sharing experiences and observations. And so that reframing has made the whole perspective around it different.
That's brilliant.
That's what that is brilliant. There's always that yin and yang to things. So there's so many professional aspirations that we all have, and we're supposed to do this and we're supposed to do that. Is that a component of what we now call burnout or shifting of that work-life balance? Or what did it look like 30 years ago, Martha, before we had all these definitions? Because I imagine we've all been experiencing it for a long, long time.
No, that's a great question. I have no idea what it looked like 30 years ago, but
Well, the reason I tied professional aspirations to it is because people have different goals,
yes,
perhaps, than people did
yeah.
a generation ago, if you're going to be a doctor, for example.
Mm-hmm. I think so. There isn't a lot of studies on this within medicine. It's more in the business world, but I think some of what we're seeing is also a values shift, right? How people perceive work and how they want to work is very different from a generational perspective. And so, I'm a millennial, and I think that my perspective about work and my approach towards work is very different from the Gen Zs who are now the medical students and the very early trainees that we have. And so I think that a lot of, burnout is real from a systematic perspective, because you can't, when 60% of the workforce has some degree of burnout, then that means that there is a system issue that needs to be addressed that probably was present all along, but how people processed it was very different. But also at the same time, I think that there's a generational divide in terms of how people want to work and how they see work as well. There's studies that look at Gen Zs especially, and for them, a lot of it is work is about experience. They're not as motivated from a compensation perspective. That's important, but really having meaning in the kind of work that they do and being connected to the kind of work that they do is extremely important to them, more important than previous generations. And then you also have to bring in the COVID factor. I can't think of a time, at least not during my lifetime, in which there was a collective pause on everything in life. And all of us, in some form, at some moment during the pandemic, we had to think about our own mortality and the mortality of our loved ones. And we had to do some soul searching and really think about what really matters to you. And so I think that after the pandemic, for a lot of people, their perspective about what matters and their perspective about how they want to live their lives also has changed as well. And I don't think that perspective is going to go back to pre-pandemic levels. There's some emergent studies that are looking at that also more in the business world as well. But I think that COVID has really changed the work psyche. And it's unlikely that we're going to go back to looking at work the same way that we did prior to 2020.
Joe, I don't want to hog all the questions here, so feel free to jump in.
No, this is great, and I'm loving all of the different and there's like all these different little roads that I want to walk down with you. But one thing that I'd like to piggyback on that you had just kind of both of you had brought up is this idea that we've watched burnout really kind of amplify, maybe is the right term. I think it's always been present, but
Mhm.
it wasn't talked about because it wasn't
Mhm.
socially acceptable to talk about it. But I think there's also been a change systematically in how we practice medicine that is very much at play. And so, one of the things I would love to get your take on, Martha, is the idea of skills, autonomy, and how those things can maybe factor in with alignment. What are your thoughts on maybe the things that contribute to burnout and what people could either try to prevent, or just your thoughts on the development or amplification of it?
No, I mean, I think that's a great question. I think when you think about burnout, there's different components, right? There's I think a small component that may be individual decisions and choices in terms of people being overcommitted and perhaps not having, the proper boundaries that they need. But a large component of it is our culture, institutional culture, and just the culture around medicine as well. And so oftentimes when I'm speaking to people from a culture perspective, I tell them you can't really change the system overnight. Our current system that we have has evolved over quite a long time. Actually, yeah, a couple of days ago, I was reading about the whole history of residency in general. I went to Johns Hopkins, and so Dr. Halstead is credited with starting the residency program as we know it in academic medicine. And we heard a lot about that during medical school. But as you look back on how things were started, and even what the people worked even more hours than they did even 10 years ago when the system started, you realize that the system was put in a place where almost people, physicians, doctors were being asked to act in a way that's almost not human. If you think about it, right? I've worked 26 hours straight before doing a transplant. And at the end of that 26 hours, and I get into my car and get home, I don't know how I got home. Like it's just a flash. I don't remember actually being on the road and getting home. And when you've worked that long, you can see the decision fatigue. You can, feel the decision fatigue. You can feel the mental and emotional fatigue. And so clearly we're being pushed, to cross the boundary between being human and superhuman, and we're not superhuman. And I think part of the reason why burnout is being spoken about so much is that people are recognizing the humanity of physicians, especially during the COVID pandemic, as we watch so many of our colleagues pass away or get sick from the virus. And so we're all seeing our collective humanity and realizing that, oh, we're being asked to do things that is really challenging for a human being to do. And so we have to speak about some of these issues. But I think as, the system is not going to change overnight. The culture is not going to change overnight. And so I think you as an individual have to be empowered to do things that allow you to live your life in alignment. And for me personally, I've realized that I can excel as a researcher. That is my goal. I want to make sure that I get as much NIH funding as possible and apply for other large awards such as PCORI awards and, really develop my lab and develop other researchers. But I know there's certain areas where I'm not going to win awards for. I'm not going to win Educator of the Year. And it's not because I'm a poor educator, because the amount of time that it takes to really develop your skills in medical education, the time that you need to spend with trainees, I don't have that time to give. I'm one person. And so it's going to be hard for me to excel in every single domain. And so I've picked the one domain where I know that I can excel in, and I'm in an environment that says, yes, we want you to excel in that domain. So we're going to support you to excel in that domain. They'll recognize that. And so as a result of that, I don't commit to things that are not research related or related to another area I'm interested in, which is development in general, early faculty development. And so I say no to a lot of things, which it's especially early in my career was a strange thing to do, but I felt empowered to do that because of the coaching that I had. And during that early part of my career, I was 100% clinical trying to build a research career. And so I had to say no. I had to practice the art of strategic refusal. I realized that, really deciding what you're not going to do is probably even more important than deciding what you're going to do. Because you're going to be asked to do a lot, especially if you are an ambitious person and you're somebody that's recognized as an overachiever, people are gonna ask you to do things because they think you're gonna do it well. And so you will be asked many things. So you have to really learn the art of saying no or not yet. And I think one of the biggest fears, especially for people early in their career, is that if Dr. Jensen asks me to do something and he says this great opportunity has come, but I know that I don't have the bandwidth to do it, and I tell him no, he's not going to ask me ever again. But I think that honestly is it's based on how you explain it. It's based on how you talk about it. And it's based on whether you actually if you are somebody who is living with clarity and people can see that you have a clear direction in where you're going. I think that when you say that I don't have the bandwidth to do that at this moment, or I don't think that this is really aligned with where my professional goals are, people will respect you for that. And that's not going to be the last time that you're going to be asked to, do something. In fact, your leaders might find other opportunities when you have that conversation with them that are better aligned with what your professional goals are. So I think we do have to be brave to say no to certain things that don't align with what we want, where we want to go, and really be brave enough to draw those boundaries around our time and our energy and recognize that we can't be all things and be in all places to all people. As clinicians, we have to be excellent clinicians and take good care of our patients, but we may not win Clinician of the Year. We may not be the person that comes up with an innovative technique for certain things. If you're not, if the primary focus of your career is not devoted to the clinical side, but if your focus is administrative, you might become, the next CEO of your hospital or be the next executive leader for a medical group. Or if it's research, you might become the next director of a research center, et cetera. But you're not going to be the director of the research center, be the CEO of a medical unit, and be an educator of the year. All in one.
What are your thoughts, Jeff?
Yeah, I think there's a old kind of it's just almost like a meme. It says successful people say no, ultra successful people say no all the time, something like that. But you're right. I mean, when you're young in your career, I remember back, when I was first out of residency and I was doing some clinical trials and I was being asked to give lectures. I would never say no because I was fearful, just like you said, Martha, that if I said no once, they may never ask me again.
Mhm.
And that can become a vicious cycle, of course, right? So saying no is the greatest word ever.
Yeah. And I would add also, Dr. Jensen, that when you're early in your career, it is important to discern when to say no, because that's also the time in which you're usually raising kids. And when your kids are youngest and there's the tax and the burden at home is bigger. I think that when my kids are 7 and 4, when they become teenagers, I will probably start saying yes more often. But right now I still have to put my kids to bed at night. And so my evenings are still tied up with them. Their social life is still wrapped around me because they have no other social life apart from me. So I think early in your career, because the risk of being mentally drained and burnout and feeling like you don't have time for your family is so high, it is important to really be strategic about what you say yes and no to.
You're both at that time of life. I do remember when I missed one of my son's first soccer games when he was 5 because I was giving some lecture in Las Vegas or something. I didn't really have to do it, but I was afraid to say no, right? I remember coming home and telling my wife, "That's it. I'm only going to certain lectures," and that was when I learned how to say no.
I love that you brought up overcommitting too, because again, it's all of the things that we're just talking about. It's you want to say yes usually to most of days. There are definitely occasions where you don't want to say yes and you feel obligated to. To me, those are the easy ones to start letting go of. But the ones that you want to say yes to, and every yes is a no to something else. So what I talk with some of the friends or colleagues, and even now some students, is, just being aware of what your yes is actually saying no to. And are you okay with that trade-off? Because I feel like sometimes what can happen is we unintentionally start saying yes to things that either sound fun or we feel obligated to do, or we are obligated to do. And this alignment starts to come. We're no longer in alignment. And if you were to ask what your values are, and you say, whatever your values are, and then you look at where you're actually spending time, that's really where people start to just feel that burnout phase, that irritability, that discontent at work. So as a shifting then in terms of trying to wrap frameworks around how do we address this, I know another thing that you talk a lot about is habits, that motivation waxes and wanes. Can you talk a little bit about habits and how you find that to be useful?
Oh, wow. I think that understanding our behaviors is just something that is just not talked about in so many forms, and the reason I got into behavior science habit formation is because when I was early in my career trying to build this research career and I was 100% clinical, I couldn't find any time to get things done. I felt like there was no time. Like I left for work at 6 a.m. and I would come home at around 5 p.m., 6 p.m. if I wasn't on call. And then I had to take care of my kids. So when was I going to write a paper? When was I going to submit a small grant? There was no time anywhere. And so then I discovered a book called Tiny Habits by BJ Fogg. And he's a behavior scientist based in Stanford. And when I discovered that book, it was like, oh, like this whole new world opened up to me because I realized that I was neglecting the power of small behaviors and how a lot of what we do is not about these big, giant chunks of time, but is really about being consistent in our behaviors and our intentions with a small amount of time that we have. And so because of his book, I ended up starting to write every single day. And I started off with literally, when you're doing tiny habits, you really start tiny. I started off writing like 1 to 2 sentences each morning before I would go to the operating room. That took about like 5 minutes. And then it morphed into 25 minutes. And I kid you not, I wrote for 25 minutes every single day for 6 months and while carrying a full clinical load. And I ended up submitting 3 papers in 6 months, and also a small grant during that 6-month period. But I could have sat back and said, I don't have the 2 hours. I don't have the 3 hours. Granted, yes, that time is needed. Now I have that huge chunks of time to work on large grants and to be working on grants and working on papers while other people are doing like the groundwork of my research. And that time is definitely needed. But when you're trying to get there, you have to actually assess your behaviors. You have to assess, are your behaviors aligned with your values? Now, we've talked about, you've identified these values as being important to you, but how are they linked to the actual things that you're doing? Because sometimes we're actually spending large chunks of time doing things that we didn't intend to do. And we kind of just unconsciously fell into it. Like when you wake up in the morning and you spend, 30 minutes doing mindless scrolling on social media, didn't intend to do that, but I ended up losing 30 minutes of my morning to that. And so I think habit formation is so important. And what BJ, and I went through a certification process through, he has he calls it's a coaching program, but it's not the same as my life coaching certification is really more consultant. But in his program, he teaches that, every behavior in a moment in time is really guided by 3 factors. And the first factor is motivation, which we're familiar with, right? Ability, and then prompt. The problem with motivation is that it waxes and wanes. Even for things that you really want to do, you may not have the motivation for it because you just don't feel like doing it in that moment, right? Especially if it's a behavior that you don't do on a regular basis, like writing every day because you're a researcher. And so motivation waxes and wanes. And so if we rely on motivation, it means that we do things inconsistently. And then ability is one of the most important factors. So if you're trying to start a new behavior where your motivation is not going to be consistent, the way to actually start the behavior is to make the ability to do it much easier. If the behavior is hard to do and you require high motivation to do it, you're not going to do it. But if the behavior is super easy to do, then you need very little motivation to actually do it. And he studied a lot of this in his behavior lab at Stanford. And so the way to then get started is that when you're actually working on a new behavior, like let's say a common behavior that a lot of doctors want to do is that they want to be healthier. They want to exercise every day, right? And, maybe you want to run every day, but you're not going to start by running 1 or 2 miles if you're not running every day. And so a very tiny behavior to do is that you may say, when I get home from work and I put my keys down, I'm going to put on my running shoes and walk to the mailbox. Well, that is a very easy behavior to do. Especially if your running shoes are right there, you put them on, you walk to the mailbox. And if you do that consistently every day, and as you're doing it, he talks a lot about how our emotions drive our behaviors. And so as you're doing that behavior, you also create a celebration, or it's not a reward, which is very different. Some habit writers talk about rewards. The problem with rewards is that they can happen at any point in time, but BJ talks about celebration, which is actually doing something in the midst, either during the behavior or immediately after, to celebrate the behavior that you do. For me, I'm a very affirmative person. And so when I started doing exercising, when I started doing working on my exercise habit, I used to tell myself, I am a woman who values her body and loves to take care of her body. And I would say that at the end of that tiny behavior. And so by doing it, you're actually wiring that emotion. You're creating that good feeling in your brain, and your brain is going to start to associate that behavior with it. And eventually, as you do this tiny behavior over and over again, usually within like just a couple days, you can start allowing it to grow. So next time you're not walking to the mailbox, but maybe you're walking around your cul-de-sac, or you're walking, 1 block. And then before you know it, you're walking a mile, and you're walking 2 miles, et cetera. And so it sounds so simple, but it's contrary to the way that we doctors operate. We're like, go big or go home. And so it's either I can run those 2 miles, or I'm not going to do anything at all, because, most people who go into medicine are high achievers. And the idea that I'm actually going to do something so tiny feels like I've achieved nothing. And so that thinking actually holds you back from actually getting things done and being consistent in the things that you need to get done. I mean, I will tell you that as somebody who spends a lot of time behind a computer, writing grants, writing papers, putting together presentations, I've realized that it does not take as much time as I think it takes to actually get my work done. It doesn't take as much time as you would think to actually write that paper or to write that grant. The reason why I needed 8 hours or 10 hours to get, 2 pages done before is because, number one, a lot of my time was not focused. I allowed interruptions to come in, and it's because I was not consistently working on that paper or that grant. But if I was actually working on it 30 minutes every day or an hour every day, now I do like an hour writing every day, then every time I get behind my computer, it's like riding a bike. I'm just getting started. I'm already on it. I'm already in the mood. I've talked forever now.
This is so good.
I was like, oh my God.
So good.
I literally just went on this
No, I love it. I started having that thought. We're gonna have to have Martha on for another episode, Joe.
Yeah.
Can I jump in and ask 2 questions? The first is about motivation. And there's once you decide you're going to do something and you say, I'm going to do this every day, it's not a decision you have to make every day because you made that decision already. That's kind of what I'm hearing a little bit of. But also, I loved your reference to affirmations. I've done lots of mental management things around athletic endeavors, and affirmations are huge. I mean, you can put them on the refrigerator, in the mirror, I don't know, an affirmation for me might be, I want to be the best dean I can be today, right? I mean, or something like that, or if it's athletically involved. Can you talk more about affirmations and how the brain works? Because they work. You do all of a sudden believe what you're telling yourself after a while.
No, I mean, that's absolutely true. And I can give you a quick example. When I started my research career early on, I did not feel like a researcher because I had no protected time. I had not published a paper in a really long time. But one of the things that I ended up writing on my Apple laptop, there's like a little sticky app that you can have on there. So like stickies pop up on your desktop. And so I had one that said, I am an NIH funded sickle cell researcher. I was not close.
Love it.
Not even close to even getting down that path. But every time I saw it, what it did is that for my brain, it would actually bring to mind, well, oh yeah, I am that. What would an NIH funded researcher do? What are their habits? What are their behaviors? Like, you know, what am I supposed to be doing right now? Like, so it really helped. It's almost like tricking your brain into thinking, like believing that you're something that you're not quite yet there. Amy Cuddy, who's a social psychologist, wrote a pretty famous book and had a famous TED Talk on her book is called Presence. But she uses the term fake it till you become it, you know, rather than fake it till you make it, is really just about becoming that person that you aspire to be, that person that is actually living their life in alignment with the values that you aspire to have in your life. And, you know, you're not trying to be that person in 10 years time, but you want to actually walk into the mindset of that person now and really almost pretend like you are that person now. And so I often say I'm like faking it till I become it in every area of my life, which is true. But Dr. Jensen, you also brought up the really important point, which I should have highlighted earlier. The reason why habits are so important is because they're like autopilot pathways in your brain. And as you do a behavior repeatedly, it becomes an unconscious choice. You don't have to make a decision about doing it each time. You know, like we know there's so many habits that we have in our daily lives. There's so many things that we do. We didn't make a conscious decision to do it, but we end up finding ourselves doing it anyways. And there's actually a study that came from MIT back in 2006 that showed about 40% of the behaviors that we do on a daily basis can be classified as habits, meaning that we're not making conscious choices about it. So it's a powerful way to really wire your brain to do things automatically and not have to fight every single time and summon up the motivation or willpower to do it.
I'm a little bit neurotic, Martha. I made a decision 6 years ago that I was going to meditate every day, and I've meditated every day for between 10 and 15 minutes. And, you know, they say, oh, it takes 66 days to get a habit going. But right now I wake up in the morning, it's kind of the first thing I do, you know, and I don't
Yeah.
even think twice about it.
Yeah. And I think, you know, they say that it takes 21 days, 60 days, et cetera. You hear different phrases, but, you know, I always say it takes as long as it's going to take. And if you start tiny, it could take as little as 5 days to actually
There you
start a
go.
habit.
I'd like to piggyback on that because two things that you talked about that I think are really, again, if I'm a listener, I wish I had met you 6 years ago when I started my like venture into all of these things that we've been talking about. But two of the things that you highlighted was the identity part. It's amazing when we can kind of identify who we want to be or who we want to be like, or, you know, however we want to touch on that. And yeah, I would love to have Martha back so we can talk about some of her stuff with DEI as well, because there are so many different things I'd love to pick her brain on. But if you can see an identity and then find the ways to build the little habits, the tiny habits, and actually something that you just recently reminded me of that I had forgotten about from Dr. Fogg's work is the celebration part, not a reward. And again, that's an important clarification. If you're trying to lose weight, for example, you don't want to eat a chocolate cake, right? It kind of defeats the purpose. But the celebration, and just I'll give a personal insight, how it's kind of ridiculous how powerful that could be. So I had restarted some of my own little things trying to be active again. And the celebration is actually the thing that gets me out of bed to do my tiny habit. It's like all I have to do is get up and put gym clothes on and I get to feel successful for the day, right? Like that's kind of such an easy thing. So like, why is it so hard for me to do it? Like, and because in my head, it's so easy. Like, do I really have to do it? But the celebration part of being able to take my 5 deep breaths, have a little moment of meditation just to myself and have a full glass of water. And I know this sounds totally ridiculous because those are very small things. That is the motivation. And now it has become my habit in the morning. And it has piggybacked into habit stacking, which we don't have time to get into today, but we'll leave that little cliffhanger for the audience in terms of other things that, again, if people choose to reach out to you. But what I would love to kind of close on is if people want to contact you or want to learn more about you, where can they find you?
Sure. I think the first place you can find me is LinkedIn. I am present on LinkedIn 5 days a week. It is my social media platform of choice. So you can look me up under Dr. Martha Kenney on LinkedIn. Or you can also send me an email at Dr. I now have to think about my own email. It's Dr. Kenney at timematterstoday.com is my email address. What I would also love to say about celebration is that it's so key because emotions drive our behavior. And so if you feel good about what you're doing, you're more likely to do it.
Absolutely.
Absolutely. And Martha, I have a whole page worth of questions I never got to. So if you'd be so kind to join us on another episode down the road, we'd love to have you back.
Sure, I would love to. Thank you so much for allowing me to talk.
Oh,
It's
this has just been so fun.
and in so many, because we, a lot of our audience, we have prospective students, we have current students, we have residents, we have fellows, we have practicing faculty at all levels of career. So there are things that you talk about that I feel like resonates at every single level, but in different ways. And so I think it's such a wonderful opportunity to connect with the audience wherever they are and whatever they kind of need to get out of hearing something. And so again, I so appreciate you sharing your time with us today. And I just couldn't be more grateful that our paths crossed. So thank you so much.
And I would say the same about you as well, Joe. It's been a pleasure meeting you and still being able to interact with you as well. And I hope our paths will cross again in person at some
Agreed.
point as
Agreed.
well. Yeah,
Definitely.
and thank you so much, Dr. Jensen, for having me as well. I really appreciate it.
We appreciate you having you on, Martha. And we send all of our guests a Dean's Chat coffee cup. I don't have one on me right now, but you'll be getting one in the mail. It's got mine and Joe's name. It's got a little fireplace, and it's got Dean's Chat, all things pediatric medicine. It puts you in the good vibe, you know.
I love that.
All right, sounds good. Well, to all of our listeners out there on Apple and Spotify, please give us a 5-star rating. And of course, if you're watching on YouTube, please become a subscriber. And until next week, and thanks again, Dr. Kenney. Cheers, everybody.
Bye.